Welcome everyone to this webinar on rapid reviews to strengthen health policy and systems. To echo Tamara's introduction, here are the objectives of the webinar. I'll be discussing the usefulness of rapid reviews and their application to health policy and systems decisions, and Jessica will then speak about some of the methods as well as engagement of knowledge users in the process, and John Levis will then compare some of the similarities and differences across the EVIPNet affiliated rapid evidence services, and that will be followed by a Q&A period. So to give you a bit of context, so globally what we're witnessing is an increasing demand for relevant and context-sensitive evidence to strengthen health policy and systems. Countries worldwide are developing universal health coverage schemes, and they need timely health system evidence pertaining to service delivery, health financing, health governance, and so on and so forth. So policymakers and health systems managers require reviews that address a range of issues, from the effectiveness of health systems interventions and policies to how and in what settings these interventions work, so reviews of implementation, science, as well as reviews of cost effectiveness. But what we've come to realize at the Alliance and at WHO in working to promote the use of review findings in policy and practice is that there remains important barriers to this process, to both the conduct and the use of systematic reviews. And we've outlined here three of the main barriers that we report. So timeliness, or the fact that too often review cycles and policy and practice cycles are misaligned. And the second one being relevance, or the lack of policy relevance of systematic reviews and different forms of evidence syntheses. And the third one is a question of efficiency. So rapid reviews then have emerged as a useful approach to provide actionable and relevant evidence in a timely and cost-effective manner. Very often they stem from requests by knowledge users themselves, so that demand-driven feature really contributes to the applicability, the usability of review findings to inform policy and systems decision. Another key characteristic of rapid reviews is their context sensitivity. So they are helpful in producing context-sensitive knowledge necessary to inform local decisions on health systems questions. They're extremely useful, obviously, in emergency response to inform guidelines and guidance in a timely fashion, but they're also very useful in routine decision-making around the health system determinants and health policy making. So obviously, rapid reviews are critical in the movement towards evidence-informed decision-making, and I would argue that this is, especially when the counterfactual is not using evidence to inform policy and systems decisions. To give you a bit of background on the rationale for producing the practical guide, which is the basis for today's webinar, the book was conceived following an identification of lack of guidance on when and how to conduct rapid reviews within the context of health policy making and health systems strengthening. And at the Alliance, we support different systematic review centers in low and middle income countries. And in engaging with those centers, we've really identified this need for guidance, the need to collate some of the good practices in the conduct and the use of rapid reviews, but also the need for open access material and tools to strengthen the capacity for rapid reviews in low and middle income countries, to be used as a teaching and training tool. We've outlined here the conception of rapid review for the purpose of this guide, and so we understand rapid reviews as a type of knowledge synthesis in which systematic review processes are accelerated and methods are streamlined to complete the review more quickly than is the case for typical systematic reviews. So what we're looking at here is really a knowledge generation strategy and not a knowledge translation strategy, for instance. And so our understanding of rapid reviews for the purpose of this guide is a synthesis of findings and assessment of validity of research evidence using abbreviated systematic review methods. So in that case, they're different, for instance, from rapid policy brief, and we'll have a chance to come back to that in John Levis's presentation. This is here the cover of the practical guide. It was developed by 3 co-editors, Andrea Trico, Sharon Strauss, and myself, with tremendous input by a lot of authors that you see here on the screen, and many reviewers, as well as folks involved in managing the production of this book. So really a tremendous collective effort. Here is the content of the guide. It introduces its application for policy and systems decisions, obviously showcases some of the methods and approaches to streamline the review process, but it also provides hands-on guidance and practical examples of rapid reviews in the field of health policy and systems research. We've also identified some of the challenges and a research agenda for the field, and I'll have a chance to come back to that. So I mentioned practical examples. One of the examples that is in the book is around a rapid review on health systems evidence to inform the situation in Syria. So what we witnessed in Syria is obviously a breakdown in critical infrastructure, including water and sanitation system, massive scale of population displacement, a loss of human resources for health, infrastructure, equipment, medicine, etc. So reduced health system functionality across the board that led to rapid spread of communicable diseases. We've witnessed in the country a resurgence of polio, whereby the disease has actually been eradicated. So, so tremendous needs in terms of understanding the situation. And in light of this, the Syria Public Health Network identified a need for up-to-date and context-sensitive evidence on communicable diseases prevention and control measures in war-torn Syria. And they conducted a rapid review to describe the trends in major communicable diseases, as well as document the challenges to outbreak and infectious disease management. The rapid review was conducted in 7 weeks, and they applied 3 main strategies. The first one was to use a clearly defined conceptual framework. The second one was to limit the time period for the literature searches, and the third one was to employ a large review team with varied skill sets. So here is some information on the key features of rapid reviews. Rapid reviews are generated through a transparent, scientific, and reproducible method that respects the key principles of knowledge synthesis. I've alluded to some of the methods in the Syria practical example, but there are various approaches to enhance the timeliness of reviews. For instance, knowledge synthesis shortcuts, automation, or the use of machine learning technology, as well as intensification of review steps or working in parallel to accelerate the review process. One important message that we put forth in the book is that it's critical for authors to document and report the methods to uphold the transparency of the process. We have included here some information about the time frame. So empirical evidence tells us that on average, a rapid review is conducted over a 5 to 12 week period, as compared to a standard systematic review that on average takes 1 to 2 years. Here is a second practical example around the issue of medical malpractice policies in obstetrics. It was commissioned by the WHO, and it's a rapid scoping review. And this infographic is to show one strategy, which is, again, the intensification of some of the review processes. So if we look at the 2 of the review stages, screening and data abstraction, the 2 first ones, the team has employed 9 reviewers to intensify the process and accelerate the review production. This here is an outline of the guide's chapters. We're not going to go in detail about the content, but the message we'd like to convey is that we're going in this book beyond some of the methods to streamline the review process, and we're addressing issues around promoting the use of rapid reviews in policy and practice. There's a chapter on reporting and disseminating rapid reviews, and there's another chapter on strategies to strengthen capacities for the conduct and the use of reviews in LMICs. Finally, I mentioned in the introduction that we've identified some of the challenges and research needs, and I'd like to mention that I've just presented what the guide is, but it's important to note what the guide is not, and that is a one-size-fits-all approach to rapid reviews of health systems evidence. So we are cognizant that there's no magic bullet in the field, but there are various approaches to streamline the process. So two of the challenges that we've identified are around the complexity of health systems evidence. So there's a dichotomy between fast-tracking the review process and trying to unpack and understand the complexity of this type of evidence. And then the second challenge is around the conduct and application of rapid reviews in LMICs. In terms of the research agenda, two priority research agenda items on the screen. The first one is potential risk of biases that might be introduced by rapid review methods, and there is ongoing research in this regard. And the second one is around the external validity as applied to rapid reviews of context-sensitive data, but that is also a challenge, I would argue, for the broader field of health systems research synthesis. So the guide is available online, it's open access, and here is the link to download the PDF version, and I understand that we'll also be sharing this information with you in due course. Thank you very much.